Hi, my name is Leah, and my community health clinical placement is at Homestead Elementary in Cherry Creek School District. The school is located at in Centennial off of Dry Creek in Quebec. Um, Forgive me as I grab my notes for the windshield survey. I was sure to write everything down. Let's see. Sorry. Okay, so the community's most outstanding assets is just that there's like a lot of open space, a lot of beautiful area surrounding the school. In fact, there's this really large trail that goes behind the school and into an open space that is frequented by people in the neighborhood. It's a really safe part of town. Not a lot of crime. There's bike paths, many trails, and so that's a huge asset. And there are also surrounding playgrounds, which is another asset. There are also a significant amount of resources within the area outside of like just immediately by Homestead Elementary at major intersections. There are a lot of connections to major highways such as C-470 and I-25, which provide access to medical facilities, healthcare, as well as like mental health crisis centers. There is not perhaps as much of a public transportation presence as there might be in a metro area, but because it is suburban, there is still opportunity and there's still ways to get around without having a personal vehicle, which is significant. Perhaps the community's biggest challenges could be honestly that it's such a busy part of town. It's growing, it's booming, and so there are a lot of major roads, major intersections that if not properly equipped with crosswalk signs, lights, pedestrian lights, things that draw attention to pedestrian crosswalks, there is a high possibility and chance for safety issues there, particularly with Dry Creek being on, with Homestead being on Dry Creek, they did just up the speed limit. So it previously was 35 miles per hour and it is now currently 40 miles per hour. And so that's an added challenge, I would argue. The most striking aspect of the community actually is I would just say that there are absolutely health services, but because it is middle to upper middle class, I think that there's sometimes the assumption that these are people who have health insurance and have coverage and have these available resources when that's not always the case. And so I think perhaps to me, one of the most striking things was actually taking the time to recognize and realize, okay, there are healthcare options out there. There's an urgent care down the street, and there's a pediatrician, and there's a family medicine doctor. But how many of those resources are actually low or minimal or free costs to a family who's struggling? So that was probably the most striking thing to me. Additionally, I would also just say, unexpectedly, I think I had grown up in the area, so I kind of thought of it differently, driving around it and doing this windshield survey and having this background of knowledge and information, having grown up there. But then unexpectedly, applying the knowledge that I have now from nursing school was a really interesting approach to kind of just think about and see like, oh, if I was somebody in a little bit lower of a socioeconomic status within this suburban lifestyle, what would that look like for me? And would it be difficult to get around? And how would I operate under that? So that was very interesting. I would also just say my biggest takeaway is that communities like these suburban communities that are upper to middle class, they can have a lot of resources in comparison to other areas. Cherry Creek School District is well funded and generally a good part of town. But it doesn't mean that the disparities don't exist or aren't present, even if they're not as noticeable as they might be in other areas. So those with low income or strained resources still need support and still need those options out there. So for everybody in all learning brackets, or excuse me, earning brackets, we still need access to clean air, low hazard, safe areas, access to food, all of those things. And that's a pretty basic rule, right? We all expect that and hope for that. And so I think just evaluating and continuing to seek out, okay, even though this is a suburban area and people might not think of it as something that has low resources, it could still be seen as low resources to somebody who doesn't have those available options to them. So anyway, this was a very eye-opening experience. Like I said, especially having lived in Centennial for majority of my life, and then to approach it in a different light and see things in a different view. So I just hope that as I continue to work at Cherry Creek Schools for this clinical rotation, I just really hope that I'm able to see the things and disparities that exist and be able to help where I'm able. So thank you.